which has been given to me is complications of diabetes. Okay. Since morning we have been seeing what diabetes is all about. So you can understand that complications of diabetes is going to have a whole field of this thing. You name any disease, then it is linked somehow to diabetes. So I will try to tell you how it is linked with diabetes. Each of the diseases, how it is linked with diabetes and why it is linked with diabetes. Many of the slides, mostly there are diagrams in it. So we will concentrate on the pictorial representation so that we get the concepts. And as you can see in this first diagram, one complication of diabetes will come in and then it calls in the other complications. For example, supposing a person is having a complication of the eyes in diabetes, they have a 65% of chance that the nerves will get affected. And once the nerves are affected, 65% that the eyes will also get affected. Eyes are affected, then the kidneys getting affected is 24%, because the kidney will show its problems only after 80% of your kidneys are damaged. So when your eyes are getting damaged, you understand that the nephro is gone for a 6, because that is your blood vessels are going for a 6, that is your eyes, the nerves in the eyes will be shown first. So your nerves in the eyes are having some problems. I will show you the types of problems you will have in the nerves of the eyes. It means that either your kidneys have already started deteriorating or it will be deteriorating in the near future, because only after 80% of damage of your kidney will the protein come out in the urine. So that is the reason why for diabetes people we encourage them to do this renal tests. Okay, the protein and the urinary tests and all, which we tell it is a precaution so that we will come to have a 4-1. So this is the reason why, okay, diabetes is such a dreaded disease. If I am having diabetes, with diabetes it is getting over means no problem, but because of diabetes nerves are getting affected, neuropathy. So once the nerves get affected and once the blood vessels get affected, then where in your body you do not have a nerve, where in the body you do not have a blood vessel. So any blood vessel anywhere can get into problem. So each of the systems one by one I will tell. Another interesting thing is the eye damage is 18% more when you compare. See, the red lines are those who are not having diabetic, not that someone without diabetes will not have eye problems. They will also get blindness, they will also get cataract, everything. But when you are having diabetes, you have 18% to nearly 20% more chance of developing eye problems. Like that for all of them, the blue lines are when you have diabetes, you have a greater risk of getting these problems. Similarly here also, this we are A1C, as Dr. Arun Kumar had told, that A1C is going to give you the count of amount of blood glucose in the blood. So you can see as the glucose in the blood is increasing, all the other factors also are getting increased. So having high glucose levels in the blood is not very healthy. And this one diagram which I got, I just wanted to play it, because many of the parents today they are having diabetes, okay, and people have started telling that diabetes is a hereditary disease. How it is hereditary means the genes which you have got from your parents have a tendency to develop, but that tendency you can break if you are going to have a healthy lifestyle, proper diet and exercise. See, here you have one gene, one set of genes inherited from the parents. It will make the pancreas to wear out easily. So those people who have diabetic parents have a tendency that their pancreas will wear out easily and therefore not produce the insulin. Another set of genes makes you hungry, okay, and there is a third set of genes which causes greater insulin resistance. Insulin resistance we saw how much of complications it brings in. So, these 3 set of genes, and we inherit from our parents the lifestyle which they have. The food which my mother and father eat, that is what I will also have to, I will like to eat, because throughout the childhood that is what I ate. So, I inherit the bad eating habits, and I also inherit the lack of exercise. So, when we inherit genes plus we inherit the lifestyle and the bad eating habits, then naturally the risk of getting tendency is high. So, it is not a hereditary disease, there is a risk, but if we are doing the precautionary measures, even though our parents are having diabetes, we can remain without diabetes. That is the positive factor. Now, these are some figures. Some of these facts we should know, because many of our diabetes patients, they refuse to believe that they have diabetes. Once upon a time I had diabetes. Okay, when did you last check up? Because as per what I can see, I feel your blood sugar levels are high. Oh, that I did in last year. So, they are not even going for regular blood fasting and this thing test. Leave alone HbA1c is slightly costlier. At least they can do fasting and PP blood test. So, they are not going for regular. Once in 3 months they are supposed to go. And if it is very acute and they have many complications, once a month taking the test also is good, but not more than once a month, it does not make sense, at least once a month. So, at least these things if we know, we can, the main thing is we are all healers. So, we see patients, and sometimes what happens is we treat them and the thing recurs. With diabetes, that is another danger, that what we have treated and goes, next time the blood sugar level, supposing the person diabetic, you have treated for hypertension, everything is okay. Again after 3 months, when the blood sugar level shoots up, the hypertension also will shoot up. So, that way, unless they are willing to control the blood sugar levels, that is the root cause. So, unless the root is going, it is difficult. So, here you can see there is an increased risk of cardiovascular events if you take a span of 7 years. The studies have taken 7 years, in that itself they are showing this is the people with diabetic and this is the non-diabetic, okay. And this is the CVD mortality, that is the cardiovascular diseases, heart attack. So, people when they have diabetes, the heart attack rates are like this. Without diabetes, your rates are much lower. Similarly, if you take the cause of death, people with diabetes, most of the deaths are being recorded as heart attack. But while the person has had a heart attack, he has also had diabetes. So, diabetes could have been a cause of his heart attack, that in many cases is not getting recorded. So, only now in the healthcare they are getting the fact that if a person has died for whatever reason, let us also make a note whether diabetes that person had or not, because only then we will get the correct figures, because we have been showing some figures 6% of the population and all that, that might not even be the true figures, because what they say is most of the deaths are getting reported under some other names. This also might have been this cardiovascular heart attack itself could have been induced because of your high glucose levels. So, that is the next is you have a chicken and egg situation here. Who came first? Did the hypertension come first and then diabetes came, or did the diabetes come first and then the hypertension came? So, whatever happens is they are very close thick friends who they call it as comorbidities. All of them lead to death and they are all very thick friends. Can you name them? Thyroid, obesity, diabetes, hypertension and cardiovascular death. So, these are the 5 ones. One is there means the others will all rush inside the body. So, it is best that when we are talking of diabetes, we always talk of total body care. Okay. When we are doing the treatment also, if the person is coming for 3 times, once we can harmonize the whole body. That person has come only for diabetes, but out of the 4 treatments, one of the treatments you just concentrate on bringing harmony into his body. that will be a better approach than leaving some things untouched. So, some of the things which we can talk is excess glucose in the bloodstream did not damage the cells until inflammation was present, and diabetes encourages inflammation. One small cut, it will not heal, it becomes inflamed. Why? Because the sugar is something which is sticky and it is having a tendency to allow the bacteria to grow. So, bacteria likes that humid atmosphere. So, in that case the risk of inflammation, one small cut will become inflamed. So, this one came and this one, both are helping each other. Then here this is the thing, when the person was diagnosed for diabetes, already they were having tissue damage. So, see, you can see the lines which are so long. Next is obesity and diabetes. They have coined a new word itself, diabesity. A diabetic person who is obese is having diabesity. That shows the amount of people who are having both. Otherwise, why will they coin a new word? So, diabesity is the new one, diabetes plus obesity. For this, you have to give counseling with respect to lifestyle, diet, exercise, and like Dr. Arun Kumar told, your ABC should be in control. Then the endothelial is the inner lining of your blood vessels. So, the inner lining of the blood vessel is called endothelial. So, what happens when there is excess glucose roaming around in the blood, it makes this lining to dysfunction. Okay, it does not have strength. When there is excess glucose means there will be more pressure. So, this one will, so what they are telling is endothelial dysfunction comes before diabetes. But diabetes itself, we know it causes the endothelial to become abnormal. So, endothelial we mean either you get microalbuminuria, that is the kidneys are affected in this case, or you have atherosclerosis where the blood vessels are affected. So, once you are having this endothelial dysfunction, either you are having hardening of the arteries, okay, hardening of the arteries, and this another thing is this alcohol and substance abuse along with diabetes, it makes the each and every individual cell to become more and more weak, okay, and it induces hypoglycemia. You know the symptoms of alcohol and substance abuse, it will be somewhat like this only, anxiety, sweating, tremors and all that. So, you can see how it is inducing hypoglycemia, and the only problem is when they are having alcohol and their blood sugar goes down, they will not be in a condition to even be aware that their blood sugar has gone down. So, it will just spiral within 3 or 4 hours they will get into the critical situations. If they are aware, if they had not taken the alcohol, if they were aware means they would have taken the meditations or they would have taken some amount of sugar or something in the mouth. But because of the alcohol and substance abuse, keeping their mind in such a unaware state, it reduces the effect. And one more thing is alcohol and substance abuse, that is all the drugs and all, it reduces the effectiveness of diabetic meditations. So, even though they are taking the medicines, along with that if they are going to take even once a week 1 glass, it is enough to destroy all the effect of all the diabetes they have taken throughout the day. It slows down the liver and worsens the nerve, makes the eyes worse. Because the eyes have become worse, they will be unstable and again they will have falls and all sorts of things. Okay, one mnemonic you can just understand, hot and dry means sugar is high, cold and clammy needs some candy. So, if you are hot and dry, it means you have high levels of glucose. So, you are in hyperglycemia. If you are cold and clammy, it means that your sugar levels have gone down. So, immediately you should put some amount of candy in the mouth, not chocolate, not Cadbury's chocolate, candy. The sugar candy, that 1 rupee sweet which you get, that is what you should carry around and have. So, there are 2 things which get disturbed with diabetes. One is the blood vessels and another is the nerves. Okay. So, nerves you can see neuropathy, peripheral nerves can get disturbed. Peripheral nerves means hands and legs, and autonomic neuropathy. This is the one which creates full havoc. Atomic means all the internal organs are going to be attacked by this nerves atomic neuropathy. So, you know your digestion will go for your 6 and your every internal organ, we will see that. Then you have the gastrointestinal going for a 6, then genitourinary also gets affected, and something called necrosis, cell death also comes. That is because your nerves got affected. Why the nerves got affected? Because your blood flow was not there to the nerves. Extremities also you can have ulceration, gangrene. Each of these I will be taking in future slides. So, when you come to this autonomic neuropathy, that is when your nerves are affected and the nerves of your internal system internal organs are getting affected, what all can happen? Heart, you can have cardiovascular system getting affected, or digestive GI tract. So, anorexia, nausea, vomiting, gastro. So, many of the times there will be diabetes present and there will be these conditions, but it will not be, they will be giving gelusil. That person is showing you all the GI things, but because you have not taken the blood test, you do not know that diabetes is creating this. Okay. Then bladder also, urinary retention and incontinence and all that. Okay. Then sexual functions, lightheadedness when standing up. Okay. This is also due to diabetes. And when the skin is not having proper blood supply, then you have the nutrient delivery and all those things, it becomes damaged. So, the spoiling effects of nerve damage is even reducing the life expectancy, and these are the atomic nervous systems. Next we are coming to peripheral neuropathy, that is the nerves of the hand and foot. So, this picture tells you exactly why the nerves got affected. This is the healthy nerve. Once the blood flow was not there, this nerve became so weak. Okay. So, this is a normal nerve, you see the red blood cells, okay, it is so tightly packed. So, when it becomes like this, this is our abnormal nerve. So, who caused this? It was diabetes which has caused this. Then central nervous system means brain and spinal cord, peripheral means all your peripheral nerves which are hands and legs. So, necrosis is death of body tissue. This occurs when there is not enough blood flowing to the tissue from injury, radiation or chemicals. This is not reversible. So, your blood clot and all that, no? When you have a blood clot, there is no blood going to a specific area of your head, then you get a blood clot. If the blood does not go to your heart, then you get a heart attack, like that. So, now we will look at the brains. Okay? When you come to the brains, there is something called Alzheimer's disease. Okay. The aged people, they get this Alzheimer's a lot. What happens is, the nerve cells of the blood, the nerve cells of the brain, okay, they lose their working and functionality. So, if the brain loses its functionality, what will go? Memory will go. So, once the memory goes, they will get into depression. So, once they get into depression, they will not take the medicines of the diabetes. So, it becomes a spiral, down-going spiral. So, this is now being termed as type 3 diabetes. So, they want to focus on this and call it a different diabetes than the rest of the thing, because brain is something which we want to preserve. And diabetes of the brain condition involves insulin insufficiency or insulin resistance. Then there are two types of strokes which can happen. One is ischemic stroke, when the blood vessel gets blocked. The other is there is a rupture and the blood flows out. So, both can happen. Once this blockage happens, the cells around that path will die. So, when the cells around that path dies, that much of memory of that person goes. Slowly it will be spreading, because we have not kept the diabetes under control. There is another disease called dementia. When we get such multiple strokes, it is called transient ischemic attacks, TIA. For 1 second, they get a blackout and they come back. They get blackout and they come back. 2 minutes, 3 minutes, like that. So, all those times what has happened is this squeeze has happened, but it is temporary. So, it opens up by itself. So, up to 24 hours also it can have been blocked. So, they will say that my hand was stiff doctor, but after some time. So, such cases and all, please advise them to take the tests of diabetes and you know, cross out the fact that they are not having diabetes. Then we come to the heart. So, in the heart the problem is often people get silent attacks, and the people who get silent attacks very often they are not obese, okay, and women have a tendency to get this silent attack more, because what happens is they get shortage of oxygen, shortage of breath, ankle swelling. Okay. Ankle swelling has become so common that any patient who comes to my clinic, even if it, especially if they are women, I look at their ankles. 4 out of 5 the ankles will be swollen, but they have lived with the swollen ankles for so much time that they do not know the connection between the ankle swelling and the kidneys. And back pain they have been having since the start of puberty. So, back pain they will ignore, ankle swelling they will ignore, and that will be all indications of renal failure because of diabetes. So, this is the thing. So, when they have ankle swelling, shortness of breath, all these things, many ladies I have heard of, they have had heart attack and they have died because of build up of water in the body. So, risk of developing heart failure is increased, and if you decrease this blood sugar levels, heart failure is reducing. Similarly, if your BMI, if you decrease by 2.5 units, then you are having 12% less chances of getting a heart failure. So, the problem with diabetes is that the blood has a more tendency to clot. Because your blood has a more tendency to clot with diabetes, what happens is any time you do not know when the plaque has built up to such an extent that it will stop the flow of blood to the heart or to the head. So, these are the things which you need to take care and be aware. So, why do diabetes develop heart failure? Because there is an association between diabetes and heart failure, that is both of them have this hypertension and coronary heart disease as risk factors. Then direct effect on the muscular tissue of the heart. We told no, anything, any portion of the body which receives blood. So, heart also is a muscle, so it also receives blood. So, if the muscles of the heart are not getting proper blood, then it is going to have the effect. Then you are also having the neurohormonal systems which get affected. Because of this, when you have diabetes, you have a tendency to have heart attack. So, this is the diagram for that. See, because you are having type 2 diabetes, you are having this, you get obese in the mid area, okay. In your abdomen area you get obese, then all your high glycerides, high LDLs, all these things cause the hardening of the arteries, and when you are having this, you also get type 2. This is what I called as chicken and egg. This one comes, this one comes, this one comes, this one comes. Then this is also an autonomic neuropathy, okay. That is, it is the problem with the nerve cells also of the emotions, from there it starts. Then myocardial infarction, that is the heart problems, it also comes down. Heart failure comes down by 50%. So, why will not a person want to keep his blood pressure under control? So, these things people are not aware of. If we tell them, they will take care and they will make it a thing. It is called a silent killer. You take any of these 5 major things, first thing to come in is hypertension. Secondary hypertension is also there. Because of the kidney getting affected, diabetes affects the kidneys and kidneys bring in the hypertension. How I have explained in details. Then if the chronic kidney disease, it reduces the functions of the diseases and causes hypertension due to hormonal disturbances and retention of salt. So, once you have chronic kidney disease, you will have this retention of salt. A retention of salt means it is more like an edema. So, anywhere you can have the edema. Once you have the edema, you are going to have these things. and it will lead to high BP. High BP can lead to heart problems. Now we come to kidneys. So mostly the main reason why the connection exists between diabetes and kidneys renal failure is the insulin which is prepared by the liver, insulin which is prepared by the pancreas, that is called endogenous insulin, which the body prepares, that is metabolized by the liver. But the exogenous insulin which we are taking as medication, 65% of that is metabolized by the kidneys. Metabolizing insulin is not the work of the kidneys. If it is going to do the work of the kidneys, naturally it has to break down. So once it breaks down, you are going to have your chronic kidney diseases, and this is how the water builds up. And you have 5 stages also of the kidney and this thing. So mostly the person will know, see it is type 2 is silent stage. Person will know only in the stage 3. Little albumin will come, it will not even be recognized. Mostly in stage 4 only you have that overt, no? So that is when the albumin really comes out in the urine and there is some stickiness, and therefore they approach the doctor. So all these 4 stages have been mostly silent. So that is the main problem why you don't wait for the kidneys to give you the signal. If your eyes, nerves of your eyes have given you the signal, please go and check your kidneys. And even nerves of the eyes, patients tell that, ipoda I did eye test and I have put new specs. The catch there is, they have tested the lens of the eyes. There is something called kidney eye check. Kidney eye check checks the retina. Retina is at the back. So you should request the doctor when you go for eye checkup, please check up my retina and also check up glaucoma. Glaucoma, cataract and this one retina has to be checked. Only then you can say that your eyes are healthy, not just the lens. Okay. So 80% kidney is damaged. That's why annual reviews is a must. Actually what they say is 45 plus, they advise you to go for annual reviews anyhow. Who does it? Then tobacco also must be stopped, because tobacco leads to toxicity for the kidneys. Now we come to the eyes. See, just you concentrate on the diagrams and what is happening to the nerves and blood vessels. Here actually the blood vessels are getting affected here. You can see this is the normal healthy blood vessels in the eyes. What happens is some leakage is there or some blockages like this. Hemorrhages will be there, all this. So naturally the eyesight will get blurred, and then you can do this. Glaucoma is the pressure build up in the eyes. Okay. In the eye, hyperglycemia, that is excess of blood, and microvascular damage to the corneal nerves can block the feedback mechanism and you get dry eyes. Okay. So dry eyes also is one of the indications, because this has happened, you have high blood sugar and your vascular system has got damaged, therefore you are not getting the feedback mechanism. Then we come for musculoskeletal. So in musculoskeletal what happens is there is one prayer sign. Okay. When we keep these 2 fingers together, we do not have any gap. But when the diabetes person, they will not be able to close the 2 fingers together, the gap will exist. So that is what they are calling as prayer sign. They cannot, their phalanges will be so stiff. Why they are stiff? Because the blood vessels has become stiff. Hardening of the blood vessels is making this stiff. So once it is stiff and they say they have not checked themselves for diabetes, send them. Or test pannittu vandanga, just do a test and come now, let's see. If it is not there, well and good. Otherwise we can take medications for that and we can make this also to become okay. Because even if we put in our full efforts and make this hand to become okay, 3 months down the line, when their blood sugar shoots up the next time, again they are going to get that hand. So they will tell, you cheated me doctor, 3 months you took treatment and my hand became okay, again it came. So, they do not understand that underlying is this diabetes which has caused the problem, not that you have done half treatment. Okay. Then that also some grades are there. Then this is the print test. Okay. You put your hand in put their hand in the ink and ask them to put how many are visible, that gives you this. So, these two are simple tests which you can find out that whether the fingers have become stiff or not. Then there are flexor tenosytis, that is the trigger finger, no? That finger will come, it will get stuck, it will not come back. Okay. For that, one simple method what we tell is, you hold this hidden thing and move the finger, hold and move the finger, hold this hidden knuckle which is inside, hold and move. So, that what will happen is, it will prevent the trigger finger. One small exercise. So, when I have all these muscular problems, naturally I will get stiffness not only in my fingers, in my neck, in my back. Have you seen patients with stiff back? Back portion will be stiff. So, on that they have to check the diabetes. Finally, somewhere along the line that will be the culprit. So, now we come to foot. The foot problems, what happens is, first there is numbness and coldness. Then it goes to intermittent claudation. Claudation means this is muscle pain, ache, cramp, numbness, like that. And then it goes to, this is when they walk they get pain, when they rest the pain goes. That is stage 2. Third stage is, even when they rest the leg continues to pain. Fourth is ulcer gangrene. So, at any of these stages we can give the treatment. Then arteries become narrowed and blood flow decreases. That is the reason for all this story. So, necrosis, tissue death. The problem here is that even the distal to the site of obstruction. The obstruction is not here, see, the obstruction is here. The obstruction is here, but these are the nerves, these are the blood vessels which got affected. The part of the body which got affected is the lower limb, but the thing is here. The obstruction is here. So, the problem of this distal to the site is complicating things for us. Then one more reason for this amputation, you can see everything is coming. Once I am having diabetes, I have neuropathy, once I get a trauma. Trauma means one slight injury, any injury whether it is slight or huge, it calls in neuropathy and vascular disease. And here you have microvascular, macrovascular, atomic, sensory, motor. So, all the range of problems are coming into play for this person to have a foot ulceration. So, as healers, when these things are happening itself, see, first it does not become ulcer, first it just has a slight black discoloration. At that time itself we can start treating them, even if we are treating them for something else, treating them for diabetes also does not matter. So, that this will come down. So, that these are the other things which can happen to the foot, corns, corns and calluses, foot ulcers, toenails, all these things which are things which can happen to the foot. Next, you have gums, mouth, teeth, all these also can lead to it. The flow goes like this: plaque, tartar, gingivitis and this thing. So, I am not going to the details, you can see the percentages are already there. Then hearing loss is twice as common in adults with diabetes as those without. So, because the ear has many small vessels and nerves. Vessels it has, nerves it has. What does diabetic affect? The vessels and the nerves. So, those are there in the ear, so hearing has to go. So, it is aided by low HDL. So, one of the things which we could treat for hearing loss is to give them a diet where the HDL levels are becoming high, and also kidney is rajma. So, that also we can give. When the kidney is enhanced, the hearing is going to be good, and good HDL will also help in the hearing. Then bones also, there is a connection between bones and osteoporosis and diabetes. The connection goes like this: there is poor circulation, so it leads to fall is more thing, and higher fracture rates. And vitamin D the person with diabetes has a low vitamin D levels, and they also lose vitamin D through the urine. We know that vitamin D is required for bones, and therefore this. Then pulmonary disease. So here also what happens is, you look at the ciliary mortality. What happens is, this is also some sort of cilia is those things like feather like things which we have in the nose, which moves and makes the blood air to get filtered. So only the filtered air will come inside the lungs. Lungs and nose, both of them have this cilia. Okay, so when this cilia gets hardened, what happens is the impure blood also goes. Once the impure blood goes, we cannot predict how it is going to happen. So it will lead to COPD. So it will lead to this thing. And why, one more thing with diabetes, how it increases the risks of pulmonary diseases. There are two diseases. One is chronic bronchitis, when the bronchial tubes are inflamed and there is lots of mucus. We know that bronchial tubes is nothing but supplied by blood vessels, and therefore diabetes is going to affect. Then emphysema, tiny air sacs, they have to of TB and diabetes. See, TB, they thought TB was cured, okay, but a person with diabetes has started getting TB. So that old age disease which we put under lock and key, it is coming out because of diabetes. And diabetes and TB, diabetes causes TB, TB causes diabetes. So both the organizations of TB and diabetes, they are looking at some people who will give combined answer. Not the person diabetes person, he will look only at diabetes, TB person will look only at TB, but they want someone, and that is where we can help, because we can look at. So weak immune system, because of that diabetes brings a weak immune system, therefore the person gets TB. And there are some medicines of TB which reduces the effect of the, I think it increases the blood sugar levels. Then skin conditions are there. In skin conditions, many of these you would have seen in the clinic. So I will not go into the details, you can just see the pictures. So all these skin conditions are possible when you are having, these conditions are specific to diabetes. These are diabetes specific skin conditions, these 8. So any of these you can suspect diabetes. Then thyroid. Thyroid also, because thyroid comes into the pace, TT and 3T are there in the metabolism of your food. So when you have hypothyroid, you have slower metabolism and it leads to weight gain. Obesity is bad for diabetes. Hyperthyroidism, so weight loss will occur, too many ketones will come, and when you treat hyperthyroidism, diabetes also improves. This one is when you have kidney diseases, all these things happen. Now sexual health. So these are the different things which can happen. Medications, which if you take your birth control pills, okay, they will interfere with your diabetes medications and vice versa. So final slide is mental health, depression and diabetes. So patients with depression, why they get depressed is because it's a chronic disease. They can't eat this, they can't eat that, and they don't have energy and all those things. So they have difficulty following the medical treatment, poor physical and mental functioning, they isolate themselves from others, and unhealthy disease. And in addition to depression, they also have denial. I am very healthy, I don't have diabetes, I can eat whatever I want. Then anger, they will take out the anger on other people, or they will suppress the anger. Suppressed anger leads to cancer and grief. All these are common. So this much for today. Thank you.